Here at UC Davis, we have this incredible social mission. We create the physicians that California needs.
We have accelerated programs that are designed to produce exceedingly well-trained primary care physicians who have a commitment to the communities from whence they came.
The track programs create a place where the students have a continual connection to their home community. We bring in the students who are from a community that really needs them, where they want to go back and work. We sort of think of them as spending their formative time here. We give them the skills they need to then go back and work in that community.
When I first learned about UC Davis, I just thought, wow, how neat is it that a medical school is so interested in the health disparities of Central Valley and the lack of healthcare access there, that they want to, partner in this program to grow essentially their own Central Valley providers.
When my family transitioned to America and we settled down in Bakersfield, I started working in the ED and hearing stories that families have to go to UCLA or go to, UCSF or UC Davis, outside of Bakersfield. Why was this? We came here to America, one, for better access to care.
Growing up, my family and I didn't know about what primary care was. And so I think that my experience of not having that and seeing how much it impacted my family and my community really drove me to want to be a part of that solution in some way.
¿Cómo?
It was really hard to find a doctor that spoke Spanish. And I saw that as an issue as I was growing up here in California.
Inferior changes are typically right
Correct.
coronary artery.
Correct.
Students come in with just a wide array of talents. So we have this ability to identify their talents and then create different types of opportunities for them as they go through.
So yeah, you're feeling for the crepitus,
Yeah.
that's the popping.
Here.
And
In a rural site, it's just you and the doctor. And that way you're able to get one-on-one teaching, you get a lot more hands-on, a lot more attention.
There's this understanding from the get-go that you're committed to primary care and everyone around you is committed to training you to be a primary care provider.
They're eager to teach and they want to have you there. You show up and you have a place and you have a role and you have your patients.
We're partnered with an attending from the first week that we're in the program, and we essentially stay with them through the 3 years in our outpatient clinic. So they really get to know us, we get to know them.
We have collaborated with Kaiser Permanente and with funding from the AMA to create this 3-year primary care program. And in California, primary care is one of the biggest physician shortages in the state. So if we can train students to do primary care, to then enter the primary care workforce a year earlier, to markedly reduce their debt.
This is what this program was for, it's for students like me that know they want to do it and just want to get it done.
Going back to my community, I think is both refreshing and empowering.
Truly, that's where I think my commitment lies, is in helping these communities be able to get the care that they need. I think that this program is a very intentional nod towards the future of medical education.
There's more than one way to get into medicine and there's more than one way to finish medicine.
If you know in your heart that primary care is what you want to do, there's really no other program that, in my opinion, that is better than this.
And even though it's hard as I'm doing it and there are days where I'm questioning my sanity as to how hard this is, I don't see myself doing anything else and I definitely don't regret it.